It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, which features some of the best doctors in the entire Houston area, Candace, that help change people's lives, like our first doctor.
That's right, Jim. It's cardiologist Dr. Annie Varghese.
Coronary disease is a type of vascular disease where plaque coats the inside of the vessel to the point where there's a growth, and that's called stenosis. The number one problem with regard to formation of plaque is cholesterol. So we have different types of cholesterol, LDL cholesterol. We have HDL, which is the good cholesterol, LDL being the bad. Triglycerides are another bad cholesterol. So it's very important to do advanced testing of the lipids.
Back in 2000, I went working, had some pains in the chest, went to my general practitioner. He examined me and said, "You need to go see the cardiologist today." Made an appointment for me with Dr. Varghese, and when she examined me, she said, "Just stay right there. You're going to the hospital."
The case of Thomas Cole is quite interesting. He came at the beginning of my practice years. I've been practicing for 18 years now. And Thomas Cole came as a new patient and just complained of intermittent chest pain. We proceeded to take care of him, and he proceeded to die on the table and had no heartbeat. So we, of course, started resuscitative measures immediately and quickly transported him to the cardiac catheterization laboratory. Found a severe blockage in the right coronary artery, and that's why he had become hypotensive. His blood pressure had dropped, his heart rate had slowed down to nothing, and he had stopped. So in the office, I pounded his chest and started CPR, and then we took him to the cath lab.
I was very lucky. I mean, if you're going to have that kind of thing happen, being in a cardiology office is one of the better places to be. The thing that's most amazing, I think, about Dr. Varghese is her concern for her patients and her constant drive or constant searching for things to help them. Not only when they've had the heart attack, but help in prevention of the heart attack. Her personality of her patient care is phenomenal.
Gina was looking for long-term effective birth control, and Dr. Marie Sleepman's E-Sure procedure was the perfect solution. To hear more about Gina's story and other life-changing stories, log on to bestdocsnetwork.com.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Gosh, I was young, maybe about 6 years old, and was tagging along with my older brother playing golf, and I just so happened to get too close to him when he was teeing off and got hit with a backswing right in the nose. And from then on, that's when the problem started.
Joey came and see me because he can't breathe through his nose. So he has to breathe through his mouth. He doesn't sleep well at night. He snores a lot, and that makes him tired all the time.
You know, you would sleep through the night but wake up and not feel rested. You know, even though you made it through a whole night and got a whole night of sleep, you just wake up and feel like, gosh, I really don't even feel like I slept at all.
When we examined Joey, we noticed that the wall in the middle of his nose, what we call the septum, that separate the left and the right side was crooked, in his case, was crooked on the right side, causing him problem to breathe through his nose. And we agreed upon a treatment plan that consists of first a surgery to correct his septum, to straighten up his septum, so to improve the nasal airway.
Very simple outpatient. Everything was explained to you. Go in the morning. I actually took a little nap right before surgery because it was early in the morning. Woke up and that was it. So it was real simple, real easy.
Joey's quality of life has improved tremendously. He breathes better, he sleeps better, and he enjoys life more.
Well, you just don't realize it because I've had it for so many years. You just get used to, you're thinking the way you're breathing is normal, and it's not. And then once it's changed the way it is, I'm able to do things without getting winded, because I'm not having to open my mouth to breathe now. I'm able to breathe clear through my nose.
The number one reason that patients come and see me is because they can't breathe through their nose. In most of the case, there's a solution for that. As a Center of Excellence in Nose and Sinus Disease, I'm always in the forefront of medical research to improve my patient outcome. Medicine has advanced so much that there's always a solution to breathe well and live well. Patients don't have to suffer anymore.
All of our doctors here at the Best Docs Network are committed to changing people's lives. Like our next doctor, it's plastic surgeon Dr. Lucian Rivela.
Cynthia came in before her wedding to lose areas that were difficult for her to fit into her dress and for her honeymoon. She knew that the cool sculpting was something that she could have permanent loss, that was noticeable, and that was non-invasive.
My procedure was right before, 3 months before my wedding, and I really had been working out hard, trying to get in that wedding dress and look perfect. So I needed little areas around my back. My little back fat would not go away, and so I asked that be taken care of.
Most patients will have a noticeable permanent loss of fat. It reduces the fat by freezing the fat cells, crystallizing them. Your body then takes it away with an inflammatory response, and over a several-month period, you'll have noticeable effects. We wanted something that didn't have long-lasting side effects, and so that it had minimal downtime, and so people can do this on their lunch hour per se. In addition, we wanted something that was cost-effective, and it wouldn't cost as much as a surgery as well.
With the cool sculpting, what it helped for me is the fact that it's not painful, it's non-invasive, and you really see results in 2 to 3 weeks. I am a little impatient, so it was one of those things that I wasn't really willing to wait for, but I would for 3 months. Thing is, I saw results in 2 to 3 weeks and then continue to see results 3 months later. So there's that factor. And the painless thing is very big, so I like that.
Definitely it's something that if someone's not looking for a large area for liposuction per se, then this would be perfect for that. It doesn't take the place of liposuction by any means, but it certainly can work with it in addition to after treatment or those patients that just don't want surgery.
Wendy was able to do it and it was amazing. Just for my second fit, or my second to last fitting, there was a huge difference. They were able to actually take it in around my my bust line. So it really was, significant. So it was really cool.
Everyone should know what their BMI is. That's your body mass index. It's a measure of obesity. You can calculate this through a very simple formula that you can find on the internet. And what you're looking for is a number under 25. 20 to 25 for your BMI is normal. 25 to 30 is overweight. If you're above 30, that's obesity. If you are in the obese range, you want to bring it down into the overweight range. If you're in the overweight range, you of course want to bring it down into the normal range. And obesity and a high body mass index is a very important thing to know about because it can affect your health. There's 26 types of cancer that are affected by obesity, as well as things like arthritis of the knees, hypertension, diabetes, sleep disorders. There's a whole lot that can be improved by improving your body mass index. So know what your BMI number is, try to get that number down and shoot for a number under 25.
Well, I was having extremely heavy periods that were just getting worse and worse, very painful, just a lot of discomfort. So the only real option for me was hysterectomy or live with it until I go through menopause. And I'm young enough that I thought it was disrupting my life.
So I tell you, when I started in medicine a while ago, most hysterectomies were done abdominally. There was a large incision made from hip bone to hip bone. Patient would be in the hospital for a week and her recovery, a very painful recovery, 6 to 8 weeks later. But what's fantastic is over the last few years, women have choices. We have technology available that allows us to do big surgeries through little incisions. And it depends on the patient, depends on what her symptoms are, depends on what her needs are, and what her wishes are.
Oh, it was so easy. I woke up in the recovery in a chair, and within an hour and a half to 2 hours, I was up walking to the bathroom. No pain at all. Went home in the car, and really I was up and walking around within, just that day I was up walking around, on my own.
It's a very new procedure and there are very few surgeons in the country that perform it. Aesthetically, it's very pleasing to the patient because the surgeon uses one incision only. It's a very small incision, approximately 2 centimeters in length, and we hide it in the folds around the belly button.
Well, it was a whole lot easier than I expected it to be. I'd had 2 C-sections in the past, and those were extremely painful procedures afterwards. And this hysterectomy, I went in the morning, did the preparation and had the surgery, and I was home by 3 o'clock in the afternoon, walking around fine. I was fine.
I think most young women, especially those who exercise and take care of their bodies, want the option to be able to hide their scars. You don't have to show them. So with the less procedure, I'm able to give them that option. I'm able to allow her to treat her problem while cosmetically achieving superior results.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
I am a World Series champion.
I am a husband.
I am an advocate.
I'm in the fight for colorectal cancer.
Because I lost both of my parents to this disease.
Because of my friend who died 120 days after his diagnosis.
As a survivor, I want to spread the word so everyone out there knows the importance of early screening for colorectal cancer.
One simple test can save your life or someone you love.
Get screened.
Be a part of 1 Million Strong.
We are 1 million strong!
When you talk about Ceci, she's talking about issues that pretty much any lady who has had several children will talk about, that they just feel that their stomach never quite went back to the way it was before.
I've been active all my life, and in sports throughout high school, my collegiate years, ran track and field and competed in Miss Fitness USA competitions and had a flat stomach for pretty much most of my life. I had 3 beautiful girls, but with the pregnancies, I had 3 C-sections also. And so having the flat stomach before and not able to achieve that afterward was kind of like, a punch in the stomach, so to speak. And I wanted to do something about it.
And you can do all the exercise in the world, you can diet all you want, and you will still find ladies that still say, I just bulge a little bit more than I remember. And why do they? It's because that tissue, that connective tissue there of the stomach, has basically been kind of stretched out like a balloon that's been overinflated, a rubber band that's been pulled too far, and it never will snap back to the way it was before.
I need to start
doing for me now, just getting my body back to where I wanted it to be. And I really didn't think of plastic surgery, but I did my research and I'm glad I did. I'm just so happy that I did.
You see all the effort you're putting in, you want to see the results, and that's frustrating for any individual to do something and not see the results from it, and that's where she was. But then after the surgery, once you get that tightness back and fix the tissues that were stretched out by pregnancy, then it just adds that whole measure back to her exercise that she wanted to have from before.
The flat stomach, it is there. We've gone on 2 cruises already, and I've been in my bikini. I haven't been able to do that in a long time, since before my competition, so that was back in 1999, so I hadn't been able to do that in a while. I'm full force working out, doing ab exercises, working out with my husband, and running, jogging, just doing all the things that I used to do, but now I can show it off and I can wear a half tank top, to work out in, it's like things I didn't think I would be able to do again, thanks to Dr. Bancroft, yeah.
As always, for more information on any of the doctors you've seen on today's show, just visit our website, bestdocsnetwork.com.
All right, time to head to our next best doctor. He's one of the best bariatric surgeons in the entire Houston area. It's Dr. Robert Marvin.
To be honest, I was kind of nervous that morning. I was really nervous. I sat there and I didn't really try to think about what I was going to have because I knew that I was fixing to go in there and have major life-changing surgery. See, I had my surgery October the 25th, 2012. This is February the 15th, 2013. So 10 days shy of exactly 4 months. And during that time, I've lost 93 pounds.
I think he's doing okay. He's in the normal range, but he could probably be doing better. And I think most of it goes to the fact that he's not putting in a whole lot of time exercising. The biggest problem we have to overcome afterwards are some of the problems that existed before the surgery.
Some of the challenges are some of the things that he was telling us about, not eating throughout the day, skipping meals, relying on fast foods. We've become so accustomed to doing those kinds of things and not planning what we're going to have and not thinking about eating. We kind of go until we get hungry and then we want to go pick up something fast and have a quick fix, but for bariatric patients that's just not as easy.
As far as how I feel now, I feel better, I sleep better, I move better, I get around a lot better, I'm more active, and yeah.
There are 3 key elements that people, and anybody wanting to lose weight can use these also, is eating frequently. To eat frequently, to allow your body to burn the calories all throughout the day instead of loading everything on to the end of the day. Second is eating foods with protein. And third, water, drinking plenty of water. Water helps our metabolism as well.
He's a young man. I think it's ideal to take care of this problem earlier in life. We already know the risk is there when we look at the patient's body mass index and their other medical problems. So there's no real sense in waiting to take care of that problem. It's better to take care of it earlier in life before it develops into something worse. And it's also better to take care of it earlier in life because they're better surgical candidates. They're going to go through the operation much easier. So.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in 2 settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas in majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, We're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting and then subsequently lower his overall costs significantly as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's just satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and of high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
For more information on any of the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. That's the place to go, bestdocsnetwork.com. Right now, it's time to head to our next best doctor, one of the best radiologists in the Houston area. It's Dr. Stephen Rose.
We are the Babetta Lindick Breast Center at the Herman Memorial City Medical Center, and we provide all these psychosocial services to our patients newly diagnosed with cancer to assist them through their journey.
It's a very, very special place, and it's a special place in part because we were fortunate to have a benefactor to provide us the state-of-the-art facility with the state-of-the-art equipment. But it's much more than that.
Well, in terms of for our patients who are coming in through our breast center, coming in for their screening, sometimes coming in for diagnostic imaging if they have a breast lump, following through the process, having a biopsy, they come in feeling well, feeling good, and then all of a sudden they hear those three words, "You have cancer." That can be very scary, particularly when they were not expecting this. So this is through our breast center, we have a complimentary service. We have a breast oncology nurse navigator just to meet with you, to visit with you, to be with you where you're at, to educate you, to empower you with questions.
A patient comes in and they're diagnosed with breast cancer. That's a big shock because most of our patients are very healthy. They don't feel sick. And so to get this diagnosis, it's a big trauma. Having someone who can navigate someone through this shock to get them through this in a very healthy way. And the reassurance that at the end of the day, most of them are going to do very well, and they're either going to be cured or they're going to have a very good result.
So when patients coming in with a new diagnosis of cancer, we are there to offer these comprehensive psychosocial services to assist them through this process and journey.
This center sees more breast cancer than any other hospital in the city of Houston, including MD Anderson. So it's a little known fact, but we have something to be very proud of, and both the ability to give the patients the state-of-the-art care, as well as to handle a large number of patients I think in a very caring way.
I'm an athlete.
I am a World Series champion.
I'm a hockey player. I'm a football player. I am strong.
I am strong.
I am strong.
Fight colorectal cancer. Demands a cure for colon and rectal cancer.
I'm strong because
I have lost a friend's mother.
Because I lost both of my parents to this disease.
I am strong because nobody should suffer. Let's beat this cancer.
One simple test and you could save your life or someone you love.
Get screened. Be a part of 1 million strong.
Ms. Gudelia Armas, she came to my office and she complained of a short fourth toe. This is a congenital deformity. We call it brachymetatarsia. And essentially, the fourth metatarsal stops growing and it's not as long as the other metatarsals. That causes a short fourth toe and a floppy toe.
When I was 10 years old, my foot started to hurt every time I used slips or like shoes. It bothered me a lot. Basically, I couldn't wear a lot of shoes or tennis shoes because it would bother me.
Cosmetically, it's disturbing, as well as it can cause problems, physically, in pain and other discomforts.
I really didn't thought there was a possibility we can do that, but when we came here, the doctor actually told me, yes, there is a possibility you can actually do it.
The procedure is done in an outpatient setting. It takes about an hour and a half to 2 hours to do, and then the patient goes home. And outside of coming in for dressing changes, suture removals, most of the work is done at home and just involves turning a knob 4 times a day. It does require compliance, as far as not excessively weight-bearing and really risking injuring the operative site.
It's been 8 months since the surgery, and I've been able to run better. I can walk faster. I can do a lot of stuff now since it's over.
The procedure itself is not painful, but it does take time. We can't make bone grow overnight, so it can take 2 to 3 months, but in the end, it's really, dramatic results, which you can see from the x-rays as well as the pictures for Miss Artemas.
It's better because I can run better, I can wear my shoes more comfortably. I don't have the feeling that, oh, I can't wear my shoes because it's gonna hurt. It's really better. I can do a lot more things than before.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
We finished the barbecue and I was cleaning the barbecue on the backyard. My wife and my son were inside the house. By accident, I guess I hit with my arm a very big leaf from a plant that we have in the backyard. And I didn't notice that there was a wasp nest on the other side of this big leaf. And then 3 wasps came from the other side and came right on me. And I remember having seen 2 wasps coming right like airplanes into my face, and I was looking at them, but then there was another one that hit me on my left arm, and that was it. Within 10 minutes, basically I was all swollen up.
His biggest mistake when he was taken to the emergency room was that he stood up. If you're allergic to the bee, or the wasp, or the hornet, it will cause a release of histamine into the system and other things that cause you to break out, swell up, and lose your blood pressure. And it's the losing of the blood pressure that's the most life-threatening.
My wife tells me that I was totally like no strength in the muscles. Everything was like drooping. That's what she says. Everything. I just lost complete control of everything, of every motion.
Typically we'll keep people on the allergy shots for a minimum of 5 years, and then we'll reevaluate where they are in terms of the usual blood test is what we follow.
The most important thing to me was that she explained to me, she made me understand what's happening. And I think that all the knowledge of the understanding of what happened to me, and that this thing can be improved basically in terms of my case, with therapy.
It's possible for a person, even if they're on the allergy shots, to have a reaction, so we don't want them to get too sure. And until you're really built up to your maximum dose and you're coming once a month, we don't really know what's going to happen. Hopefully you're not getting stung, but we always want them to be prepared for if there's multiple stings or if by some chance it didn't work as well.
I like to understand things, and I think that having the knowledge of what happened and the treatment, and there is a process, definitely has given me and my family a tremendous peace of mind.
That'll do it. That'll wrap up yet another edition of the Best Docs Network, featuring some of the best physicians in all of the Houston area that are changing people's lives.
And for more information on any of these outstanding doctors in the Houston area, head to the website bestdocsnetwork.com.
And if you have a question or comment, we'd sure love to hear from you. Just send us an email at info@bestdocsnetwork.com.
So long, everyone. We'll see you next week.